assess our mothers and sisters and examine their breasts. لأنه as you know, prevalence of breast cancer unfortunately is للأسف increasing, and we are not doing a great job in terms of screening. This is your rule, you have to screen yourself at one stage. If you have family history, I encourage all of you. رحمة الله عليها واحدة قريب توفت قبل يومين from breast cancer. This is the second in my family. Dying, she very young يعني. It's killing us. Breast cancer in our society. يعني your job as clinicians is huge to increase the awareness among yourselves first and among your families to do screening for breast cancer. So what you can do if you are sitting in the hospital, if someone is admitted with congestive heart failure, for example, or pneumonia, and you can just simple examination, you will be taught this surgery, how to examine for breasts. والله لو in your entire career لو طلعت مريضة واحدة early diagnosis from this technique, والله it will make up your studies and your techniques. يعني لو كل المرضى اللي تشوفيهم كل حاجة كم تشتغل من 25 30 سنة بعد التخرج، والله لو طلع منك مريضة واحدة شخصيا انت بهذه الطريقة it will make إن شاء الله الحمد لله لازم نصنع ثانية بنتي ما بقاش في حياة إنسان. But please don't stop from doing this, especially females. And there's a very sensitive issue. Most men do not even mention it. لأنه كل أغلب الناس they will say they will refuse. فلكن بالنسبة لكم please عليكم دور كبير among yourselves first and among others, especially ladies when they are admitted to the hospital. You have part of, and it's from textbooks, part of the examination of the chest is to do breast exam in minutes. Okay. طيب, and then we'll go to after the inspection, after the evaluation, we have the percussion. You need to know where to percuss. Okay. So where to percuss? How many areas did you percuss? Anteriorly and posteriorly? No. Okay. Yeah. Where? So how many areas? How will you see? Can you stand up and show me your colleagues? Show me who you are going. Stand up. This one. Show me where are you going to. I cannot hear you. So how many areas in the right and how many areas in the left, and what should it be? Just show me. Have you done it, Doctor, on one patient? Have you done it? Talk to me. Have you done it? Okay, show me. How will you do it? No, just tell me. كده أو عمل كده أو كده. Don't demonstrate that. Okay. كيف how do you proceed؟ هذا الكلام you be evaluated زي كده يعني. هذا زي كده. كده. طيب. Okay. طيب, how many areas? How many points? So 1, 2, 3 will be enough. Anteriorly, you may increase it to 4 if you want really high. The abyss, if you want. Abyss 1, 2, 3, 4, and then 2 in the axilla. الأجزاء بعضكم الأجزاء بعضكم percuss down. It's usually really high up. Really high up الأجزاء. So we have to feel the sweat of the axilla to be sure that we really examine that. So you have 4 points if you have apex and then 3 points. Be aware there are dullness, cardiac dullness, and liver dullness in the osseous exam. If you are doing it correctly, you will demonstrate the dullness of the cardiac or the liver. We'll ask you what sound is that. You have to say this is a dullness of the heart, a dullness of the liver. It's different dull. And so this is another way for us to see you doing the right things or not. You didn't demonstrate dullness, cardiac dullness, or hepatic dullness. You have to demonstrate that. If you didn't demonstrate this in your routine examination, even among yourselves, when you are studying at home, study groups, you have to demonstrate the dullness of the heart and the liver. So this is normal. That's why the auscultation and percussion anteriorly may not be of great value because of the other structures that are available anteriorly, like the liver and the heart. طيب, to master the percussion يا جماعة لازم في البيت كل هذا شيء في الهارت إنه you have to have the stethoscope, listen to yourself, and everybody at your home you have to listen to him and train yourself. At the same time, whenever you are sitting and studying, percuss. هذا كيف الصوت حقه؟ Whenever you go at home, just keep percussing. والله. Anyway, seriously, because you need to master. And where to percuss? Use the middle finger to percuss where? On the knuckle or on the bone?
The bone.
The knuckle. On the joint. You percuss on the joint and add a nearest point close to the body. The joint.
صح.
اي بابا مش على البون نفسه. Okay? Not on the knuckle. You percuss on the joint and الحين عجبتكم So percuss on everything. So different. You have to appreciate, your interpretation, whether it is resonant or dull, depends on the sound or the feeling. For juniors like you, depends on the sound. For seniors, when you become expert, the feeling. So you need to train yourself. When you percuss on, wallah, I'm serious, I'm not joking. You have to percuss on many things to get the sense of the nature of the subject you are percussing. Because when you are percussing on the chest, you will need to interpret the findings. And we'll learn how to interpret the findings right now. طيب. This is the percussion. Again, the technique itself, how to use your hand. From doing bedside teaching before, I've seen some of you have problems in the movement of the hand. So you need to train yourself how to move your hand. And it is clear. Once we are assessing skills, at the time of the exam, if you are poor in doing these things, wallah, to be clear from the first percussion note that you are doing. So these kind of things need training. Looks easy. Percussion, easy. Percussion. But it needs training. The more you do it, the more expert you'll be looking when you are doing this in the exam. And believe me, wallah, don't do it for the first time in the exam. You will fail. You are dealing with experts, not me. كل الأستاذ اللي بيختبروكم they are experts in their field. The minute you are coming to us and doing percussion كده وما أنت عارف what you want to do وكانك أول مرة تسوي percussion ويدك بعضكم كده يسوي percussion بعضكم يسوي شغلات عجيبة يعني في percussion. Don't do it for the first time in the exam. I will advise you. Believe me, you will fail. We have one station specifically for percussion. بس في الإكزام بس ما في غير بالبيشن وبركشن حق الشست anteriorly or posteriorly. We are looking at your technique, how you proceed from one area to another, how many areas you are conducting, and posteriorly we are looking where do you put your hand. There are the shoulders blade. Some of you percuss, for me, if anyone percuss over the shoulder blade, 0, fail, then end of story. If you percuss over the shoulder blades, that means you do not understand the anatomy of the chest and you don't know why you are examining the patient. How come you are percussing over a bone? Bone! You percuss over the bone, you are percussing to look for the findings in the lungs, correct? So that's why in the shoulder blade, you need to percuss above the shoulder blades and then in between, fair and midline, and 2 points below so probably 4 points. One of the apex, if you want 1 point above the shoulder blades, or you may skip that, and then 3 points in the midline, كده 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 كده, and 1 point below the shoulder girdle. The tibial scapula, you have to know the anatomy. Tibial scapula, tibial scapula, then the spine of the scapula, and to avoid, you have to be extra cautious. If you can't ask the patient to do like this, it's not necessary, but you know that The scapulae are here, and there is a center there, so you percuss. So in these points, and be away. If you didn't percuss for the apex, you need to mention to the examiner that I will percuss for the apex right now. And if you didn't percuss for the axilla, you need to tell the examiner that I will need to percuss for the axilla as well. And we say 2 points, 1 point above, 1 point below. Okay?
احنا في المستشفى البركشن على 5 area supraclavicular وان underclavicular infraclavicular supramemory inframemory بعدين في الاكسيلا هذا
fair enough. Yeah, I forgot to mention you need to percuss the clavicle. Sometimes it may be infiltrating tumor. So the apices and the you can percuss with the clavicle, and then 2 points or 3 points. 1, 2, 3, and 2 points here. Okay. طيب. Now let's proceed to the thing that correlates all our talks with the findings. طيب. هنرسم مع بعض ونرسم معايا مع بعض. هذا القسم. طيب عندنا our airways. مين سؤال هذا؟ Right. Now let's go to auscultation. So when you are auscultating a patient, you need techniques of where to put your stethoscope. As we said, you put stethoscope, same areas are where you do the percussion. Okay? Right. And you need to listen for how many breath cycles to do a really full auscultation? 2 breath cycles. In every single spot, you need to do, you have this 1 cycle, second cycle, and then you proceed to the other cycle, the other area. You may need to ask the patient to clear his throat and listen again. Okay, 2 cycles, and ask him to take an effort in doing the breathing in and out. You may ask him to breathe from his mouth to listen. Okay, this one thing. Other thing. You finish auscultation, what do you need to tell me? Imagine I'm the consultant on call, and you assist a patient in the emergency room. She or he has a pneumonia, and you want to tell me the findings. Okay? So, in auscultation findings, what you are going to tell me by the phone? You need to talk about auscultation. About what? What sounds? Breath sounds. So what kind of breath sounds? So we need to talk about the type of the breath sounds, and then type and intensity of the sounds, and then you need to talk about added sounds. Not only that, we need to talk about the timing of the added sounds, inspiration or expiration. Right. Before we proceed any further, we need to talk about some basic physiology. So how can we differentiate between breaths, the bronchial or physical breath sounds?
Does it